I'm Dr. Ali Mattu, clinical psychologist, and today I am joined by psychiatrist Dr. Alex Canetti. Dr. Canetti, thank you so much for joining us today.
Thank you so much for having me here.
So there's a question I've wanted to ask you for a long time, which is, is there a connection between anxiety and risk for suicide? We talk a lot about depression and suicide, we talk a lot about substance use, but what about anxiety?
The best we can think of, or the best way I can explain it, is when the anxiety is so severe, when it's really, really getting in the way of everything, it can lead to hopelessness. And we know how hopelessness in depression is definitely a risk factor for completed suicide. Things that can increase the risk for suicidality is substance use in anxiety. When you feel very anxious and almost like everything is out of control, one of the things you can look for is for substances to almost like in a way help you, what many people call self-medicating.
Right.
So I feel very anxious, but I take this pill and it helped me feel better. And that pill you're getting from only God knows where, you're taking more or less than what should really be happening, and can lead you to some other substances.
Do you think that one of the problems here is also how anxiety is picked up? Because it's so often in my work seems to be underdiagnosed, often ignored by people who might be around the person who has anxiety, or by the person themselves. They might not know that they have anxiety. Is part of this the problem, that we're struggling to identify it? It's
harder to identify anxiety when you are worrying, right? That's when we talk about anxiety, those excessive worry thoughts, and you almost think that it's normal. Many people always had it, so I always felt this way, what I think is a problem, and they don't talk about it. They don't talk about it with others, even though it's interfering and it's getting in the way of their full potential.
So it can be this invisible force on the person that they might not be aware this is a problem, and other people might not see it.
Definitely, especially if it's always been there in some kind of degree, and many times it runs in families. So if my mom is also anxious, that's all I know. And she's trying to do the best she can, and that's all I know, so that's like my norm. She's anxious, I'm anxious, she's not looking for help, she's struggling, and that's all I know. That's what I'm gonna do also, try to do the best I can.
How do we understand what's normal anxiety and what is anxiety that is more problematic and more of a disorder?
So as we were talking a little bit before we started, I said how I feel anxious about doing this today. And you said, hey, a little bit of anxiety is good, right? Because it made me prepare. I got here on time. I got ready in the morning. I was thinking what I was going to talk to you about. And that's okay. And that actually helps me to thrive. And if I get so anxious that I just cannot leave the house, and all I'm thinking is like, what am I going to say? What am I going to say? What are they going to think about me? What if I screw up? What if I say an F word? What if something happens that none of this can be used, right? It interferes with my sleep. It's going to interfere with my ability to concentrate and to do things. And it just snowballs into something that really takes over my life.
What do you do? How do you cope with that kind of anxiety? What are some of your recommendations?
So hopefully you'll be able to talk with someone about it, because when it gets to that point that it's getting in the way of you working or you studying or you having a life, a social life, hopefully you'll be able to talk with someone to help you find help. Help you find an expert in the field that can treat you. There's like many ways to treat anxiety that they help. We know it works. Hopefully you can find an adult in your life that you trust. Maybe a guidance counselor in your school, or a teacher, or a friend's parent that you're friendly with, or maybe if you have a pediatrician that you've been seeing all your life, and you're able to talk to that person, and they can help you connect you with somebody who will be able to treat you.
If someone is interested in seeking treatment, what type of treatments have been helpful for anxiety?
So there's many treatments that have been helpful for the treatment of anxiety disorders, and these include therapy, what we sometimes we call talk therapy, or medication management. I always joke around saying that in the test, the correct answer is always both medication management and therapy, and that depends on the severity of the anxiety. By severity, like how much is interfering, back to the interference, how much is interfering with your day-to-day activities. It could be talk therapy one-to-one with a therapist, or it could be in a group setting. Again, it depends on the type of anxiety that you have and what the expert recommends.
For people who are watching this video who might be struggling with anxiety, what recommendation would you have for them to move forward?
For people who are watching, if I had like just maybe one last the one caveat or the one take-home message for today would be that we do understand how overwhelming it may feel in the moment and how difficult it is on the day-to-day life, and there's always hope and there's always help.